Hello, welcome. I'm Dr. Lydia Parker from the Parker Skin and Aesthetic Clinic. Tonight we're going to talk about rejuvenating the periorbital area, the area around our eyes. The eyes tell it all, right? They're the window to the soul, and that's where everyone's looking when we're speaking to you. We're looking at each other's eyes. And the eye area is actually the first area where we tend to notice the earliest signs of aging. There's a lot we can do non-surgically to help us look younger, rejuvenated, refreshed, less tired around the eyes. The eyes kind of show a brightness and an alertness, or the eyes can show us looking tired and weary. So we want to look refreshed, brighter, and less tired under our eyes. Let's show you this evening how we evaluate the periorbital area, the area around the eyes, how we decide what will help you most, what you need. Then we'll show you how we treat these areas non-surgically, and then we'll be happy to answer your questions live. All right, so today we're talking about rejuvenating the eye area. So, you know, the eyes are the windows to our soul, right? And your eyes are where everyone's looking. So when someone's looking at you, they're generally looking at your eyes and your eye area. So it's really an important place to treat, not only for that reason, but it's also often the very first area where our face can start to look a little tired, or start to show the earliest signs of aging. So every day, we work on helping people look younger, fresher, more awake, less tired by working on the eye area. So Shannon here is in great shape, but she's allowing us to demonstrate on her. So there are a few easy non-surgical treatments that we can do that really make a nice noticeable difference in the eye area. One is Botox. I use that term generically. Botox or similar, like Dysport, for example, can be used to give a very easy non-surgical brow lift. So with Botox or Dysport, we can get a little lift like this by treating the muscles that pull our brows down so they become relatively weaker, and the muscles that raise our brows up are relatively stronger, and our brows will rest in a slightly higher position. This is wonderful for helping our upper lids to look better, because you can see that when our brow is back where it used to be, because when we're younger our brows are a little bit higher and a little more arched. Over time our brows become a little lower and a little flatter. So with a drop of Botox here and a drop of Botox here, we can gain back a more youthful arch and have a lift to the upper lid and a lift to the brow. Very easy non-surgical brow lift. I don't think Shannon has much of a need, but if you can turn to the side and smile for us. It's when we smile that we start to get little crow's feet lines, and Shannon doesn't have much to show, thankfully, but if she did, we could put a little Botox there to help us smile without wrinkling there. So Botox is our friend for non-surgical brow lifting and for treating crow's feet. Under eye area. So the big things about the under eye area, I feel like this is a place I can make such a difference for people. It's a place where one syringe of filler can make a huge difference, and I think in most cases be even better than surgical treatment for the under eye area. We all, over time, develop a little bit of a shadow here that becomes deeper and deeper over time and causes us to start to look tired. But the other thing that it does, as this infraorbital hollow or hollow under the eyes, as this hollowing under the eyes becomes more and more accentuated over time, it causes our skin to drop. It contributes to laxity of our cheek. This is a big cause of why eventually we start to not like this nasolabial fold. We all have a nasolabial fold, right? Even little kids have a little crease here. But the reason it starts to look worse later on in life is because as we hollow out here, the cheek starts dropping, and we start to not like when skin starts hanging over the nasolabial fold area. We want to keep that upper cheek lifted, and when we treat these infraorbital hollows, it does help to lift the upper cheek. So what we want is this upper cheek to be back in position here where it was when we're younger. Takes away the tired. We look less tired, we look rested. Instead of looking tired when we're not, we can look not tired when we are, right? So we want to keep this positioned higher, which we can easily do with some hyaluronic acid filler injection. So, you know, the Restylane, Juvederm, RHA types of hyaluronic acid fillers, which we use for different areas of the face. We can use some of those fillers, a very light, delicate one, to keep the skin a bit lifted here. And the important thing about that, it actually, when this stays lifted here, it helps us to not be droopy there. We want to keep this lifted. So Shannon today is going to allow us to start lifting the skin under her eyes. In this area, we can commonly expect bruising. Bruising is extremely common when treating this area. So we want everybody to plan for that. The other issue that we commonly want to treat in the eye area is not only lifting the brows, but tightening up the skin. When this skin gets looser than Shannon's is now, an upper lid surgery, blepharoplasty by a plastic surgeon or oculoplastic surgeon can be very helpful to nip and tuck the excess skin there. But when it's not so bad yet, or maybe even in someone who's already had that surgery, but the skin is starting to loosen up some more and you're not really ready for more surgery, we can do some non-surgical tightening here. Thermage treatments can be done in that area, but a fractional CO2 laser, a resurfacing laser, can be used to tighten up the skin, and can also help scarring if you have scars from past eyelid surgery. So these are the primary treatments we use. Those resurfacing lasers are wonderful in the under eye area, treating crepey skin, which Shannon doesn't really have yet, but eventually our skin becomes thin and crepey and we have a lot of fine lines there that don't really need Botox or filler, but we just need to resurface. We need to rejuvenate that area. So resurfacing lasers all around the eyes with either a non-ablative laser like Fraxel type laser, or an ablative type CO2 laser. CO2 gives the most tightening and the most smoothing, can really refresh the skin, make it smoother, tighter, less crepey. So today we'll demonstrate lifting these under eye hollows to help us look less tired. And it's actually lifting for our cheeks, so takes a few years off, helps us look younger too. Very clean skin. Ice a little bit first, keep it cool. And with fillers, the improvement is immediate, right? So once we put it in, it already looks better. But we do need a little bit of recovery. It really takes a couple weeks to fully adjust to your final result. We'll choose different fillers for different people depending on skin thickness. Shannon doesn't have real thin skin, so that's nice. Easy to work with. And depending on how deep the hollows are, and depending on how fallen the cheeks are, Shannon's still in pretty good shape. Her cheeks haven't fallen much yet. And we can somewhat just watch the skin rise, and that's really what we're doing when we're treating under the eyes, is lifting the skin. We're lifting it up. Repositioning it back a little higher so it's not dropped or sunken or caved in here anymore. Alright, it's a little bit lifted already, which is very nice. Let's lift it a little bit over here. Gaze up toward the ceiling, but keep your chin low. Nod your chin down low, eyes looking up. That position really accentuates. Anyone who gets their under eyes treated by me knows that I'm always asking for chin down and eyes up, but that really accentuates these infraorbital hollows or hollows under the eyes. You can really see where the filler needs to go. It's not a flattering position, but it helps me see what you might see and notice in certain lighting, certain mirrors, right? Okay, look straight ahead, please. Okay. All right. Look up. Thank you so much. Very good. I always feel like that little lift right there really helps us to look more like we used to. Sometimes I say brings the cute back to our face. Looks cute like when we were younger. If you're taking any NSAIDs, non-steroidal anti-inflammatories like ibuprofen or something like that, you might have a little more bleeding and bruising. Add here. Right there. Gaze up toward the ceiling again, if you don't mind. Keep your chin nodded down low. That's perfect. So here, in this case, we have a little bit of hyperpigmentation as well. So some of shadowing or darkness under the eyes can be due to some freckling or brown pigmentation. So we have a little freckle there, so we can easily fade that with a pico laser. And look straight ahead. Thank you. Okay. All right, so a little bit more lifted, more rested on that side. The difference can be dramatic, and someone whose under eye hollows are pretty bad. Shannon's weren't bad. Young women have such an advantage today that they can start doing things like this at a young age, and they don't need a lot and they don't need it often, and they can just maintain themselves and just keep it looking good all the time. I mean, someone like Shannon can literally never have bad dark circles under her eyes and never have her face get very droopy just by getting a syringe once in a while to keep things hydrated and lifted. That was the last drop, but I think one syringe was nice for you. I typically just do, for the under eye area, we'll only do one syringe at a time. Even if someone had deeper hollows and needed more, we don't want people to have too much in the way of swelling or bruising. So I'll usually stop after one syringe and let that little bruise go away. After you get filler, there's a little bit of puffiness in the first week. It doesn't necessarily look bad because you have a little puffiness where you needed a little poof, but in the first week or two it might look like you have a little more filler than you actually do. Once a little bit of minor swelling, puffiness goes away, then we can really see where you do need a little more filler and where you don't. So let that little bit of bruising go away. And then in the future, whenever it starts to look a little hollow under the eyes or a little tired under the eyes, we can lift it back up and let it never get bad. So maybe you can see little needle marks. These we can fade right away with the V-beam laser. Those will go away pretty immediately. Maybe we'll actually treat your bruises today. So they're, so they go away pretty immediately, okay?
Okay.
If you're able to ignore the little needle dots on your skin, I can let you look in the mirror and see that the skin's just a little bit lifted under your eyes. We only have half a syringe on each side. The other thing you might notice, we start to notice that people blink a lot or blinking a little funny because there's numbness temporarily. There's lidocaine in these fillers, so people can start to feel a little numb under their eyes. The lower lids may feel a little bit numb. We see little dots like that a lot in people who might be taking some ibuprofen or anything similar to that, or baby aspirin, anything like that. But they go away very quickly, and we'll make them go away faster than they would naturally go away on their own. You're welcome to look. You have some little needle marks.
Oh, I love it. I can't believe I love it.
Can you tell you're a little bit lifted under your eyes?
Oh,
yeah.
I look awake.
Yes, yes. Well, the other thing that makes us look awake, if you look in the mirror, so we look less tired when we're lifted under our eyes. The other thing that can help us look less tired is when we get our brows lifted with Botox, and that really does make us look more awake. So lifting the brow and lifting above the eyes and lifting under the eyes really does help us to look more awake. Good. So we'll laser those little bruises, and you should look, probably feel like you look better, and the downtime of looking worse before you look better shouldn't be too bad.
I look younger.
You do. You do look younger. It puts our upper cheek back where it used to be. It really does take a few years off. Though a lot of people just want to look less tired, we're really taking a few years off at the same time. We're helping people to look less tired. It's one of the most common things we do, and honestly, when someone comes in sometimes saying, I don't like these nasolabial folds, or I don't like my marionette lines, or I don't like my jowls, or something like that, a very important part of helping that is lifting them under the eyes. Taking away those hollows under the eyes, it lifts the cheek and helps you to not be jowly, not have deep nasolabial folds, or not have bad marionette lines. So this is an important part of the non-surgical lift. So how was it, Shannon?
Not bad at all. It didn't hurt at all. And I can't get over how much younger I look and less tired. It didn't hurt. You do feel, you hear the noise, but it doesn't hurt at all. And I look good. So I'm very happy. I would do it again in a heartbeat.
Okay, thank you, Shannon, for letting us watch your under eye filler treatment. I want to show you how we treat bruises. After someone has their under eyes treated with filler, they commonly have a little bit of bruising. So we'll show you how we do that. Part of our services here is offering free laser treatments on bruises. Can you show us that video, Nina? There we go. Well, this is later. I'm going to show you how I had my eyes rejuvenated, but let's show the video before that, please, Nina. Thank you. So whenever we do any lasers, and there are other lasers we use around the eyes for rejuvenation to make the skin smoother, firmer, less crepey. We'll show you that as well. And we're going to show you before and afters of people who kindly let us share their before and after photos. So you can see the results of a variety of treatments that we do for helping ourselves to look younger. This is the V-beam pulse dye laser. It helps fade anything purple, pink, or red. So in this case, we're fading some bruises that Debbie had after her under eye filler. Under eye fillers are being used more and more commonly today for lifting and treating dark circles, helping us look more tired. Volbella was just recently FDA approved for using under the eyes, but we have other fillers that we use as well. There's a brand new filler called Redensity from RHA that looks quite nice under the eyes. Helps with lip lines as well. Nina will. All right, so here we go. Sorry for the technical difficulties. So this is someone who was treated with under eye filler. These two photos were taken 30 minutes apart. This was 2 syringes of Restylane used under her eyes. She complained of looking tired and wanted to look less tired. A lot of people complain about bags under their eyes as well. So people will come in saying, I look puffy under my eyes, or I have bags under my eyes. But what's really changed, what's really different is this part caved in, this part sunk. And when we lift this hollow part up, we no longer look baggy under our eyes. We look smooth. This photo was taken 30 minutes later. She has a little makeup on to cover up a little bit of bruising, but you can see that it's smooth and firm there now. We don't have bags and we don't have under eye hollows. So thank you very much for letting us show your photos. Here, we've actually had a few different treatments done to help us look less tired. You can notice that in the before photo, see how the eyes just looked a little more tired. The upper lid is just looking a little tired, and in the after photo, it does not. So we had a couple things done here. We used the CO2 laser, a skin resurfacing laser, to tighten up the skin. We used a little Botox to lift the brow, and it looks like we have a beautiful job of microblading eyebrows here. Thank you, Jill, for microblading the brows. So the combination of these treatments has helped to look younger and more awake. So thank you for letting us share your photos. Here, this is a nice example of a Botox brow lift. So you can see how here the brow is actually a little bit lower. It helps us, it just makes us look slightly tired compared to how awake. It's actually a younger look when we have a little bit of Botox. A drop of Botox here, a drop of Botox here. It takes a minute to do. It's quick and easy. The effect kicks in about 2 weeks. I should mention while we're here, it's not just Botox. Dysport is available as well. And before too long, in the coming months, there will be a new longer lasting product available coming soon. This is an example of Botox being used to smooth crow's feet around the eyes. So when we smile, you know, we get this sort of accordion pleating effect by our eyes. And this patient here is pretty young, but even at a young age, some lines with smiling that are greatly diminished with Botox for the crow's feet area. So another great use. This is someone, thank you for letting us use your photos, who actually had full face resurfacing laser, but including around the eyes, and just a little bit of filler one time under the eyes. But if we're focusing in the eye area here, even though her skin looks better overall, less tired under the eyes, right? Compared after to before. That's a combination of using skin tightening resurfacing lasers along with just a little bit of filler to pull up the upper cheeks a bit, help the cheeks just tug them up a little bit to look less tired under the eyes. So this is me getting a resurfacing laser done. Thank you, Dr. Lisa Meek, for doing my laser resurfacing. This is our newest resurfacing laser, the hybrid laser. We can do a very gentle resurfacing, or we can do a very strong, aggressive resurfacing with the hybrid laser. But I had my full face done, but I was most interested in getting treated around the eyes, and I'll show you why. The eye area is usually the first to show signs of aging, crepiness under the eyes, fine lines under the eyes. So this is me before my hybrid laser, and then after. So this is called a pinch test, highly embarrassing, but this is, see how my skin did not bounce back. And after the resurfacing laser, you can see how my skin bounces back better. There we go. Our skin can just tent up and doesn't bounce back. So it helps fine lines, crepiness, and brings back that elasticity to the skin. These are before and afters. Even on people who are quite young, we treat, gosh, boys and girls, sometimes in their teens and 20s. Dark circles can start at a young age. We all get them. But this is with Volbella. Volbella is the only filler that's actually FDA approved for the under eye area. We can see before and after, treating not only directly in the dark circle area, but treating the upper cheeks, pulling the upper cheeks up, in this case with Voluma, to create a younger and more rested, less tired look. It reduces our need for makeup, right? Because so many of us are using under eye concealers here, right? Not wanting to leave the house without concealer. The light reflects so much better. Hopefully we get you to the point after your treatments that you don't need under eye concealer. The other things besides Botox and fillers and lasers that rejuvenate the eye area, there are some easy things that you can do at home, just some products you can use that help us to look younger. This is Upneek. Upneek are the new eye drops that were FDA approved not that long ago for helping our eyes to just look more awake and more open. So you can see before putting the drops in, the eyes just look a little sleepy, a little tired compared to how awake they look with it. So the Upneek drops actually lift. It's like a garage door opener, okay? Lifts the upper lid, just opens the eyes more. So they are more open, less closed. And trust me, I wouldn't do a webinar like this without putting my Upneek drops in first, because they do make our eyes look quite more awake, more open, younger, and I actually make our eyes look whiter too. So great before photos, videos, that sort of thing. Some new products for the eye area. The Youthful products from Obagi help us. There's a new brow product, a great brow product, which I personally use to help regrow sparse brows. Their lash product works great. Latisse has been around for years, using Latisse for the upper lashes, and now the Obagi Youthful can be used to create longer, thicker lashes. I've had great success with this myself. So let's switch over. There we go. So there are a number of things that we can do to help us look younger under our eyes, products we can use. Eye creams, of course, too, right? Eye creams help, but I always say there's no such thing as a procedure in a bottle or in a tube. So I think it's great to use firming and smoothing eye creams. There are a number of those available. We'll recommend different ones to different people, depending on what they're looking for, whether they're trying to be less dark or smooth fine lines, help crepiness, firming and tightening. So, So let us know if you have any questions. We're happy to answer any questions. In the office, of course, we're happy to see you individually and look at your eye area, look at your whole face, really. Full face assessments are most useful, helping you to decide how you can reach your goals best. Sometimes we can just have a quick look at you and let you know what's the one quickest, easiest thing you can do to help you reach your goals, help you to look younger or less tired, more awake, that sort of thing. But we have a number of tools available and they are extremely helpful. So Nina's going to help us look at our chat. If you have any questions, feel free to type them in. We're happy to take questions now and answer them live. We also want to thank Allergan because Allergan has donated a free year of Botox. What an exciting, wonderful gift. Someone can get, I believe, up to 40 units of Botox up to 3 times a year. For free. It's a fantastic gift. We can use this to rejuvenate the eye area, help to lift your brows, treat crow's feet, but of course we can use it to treat other areas too. We can treat the 11 lines between the brows, we can treat the forehead lines, whatever you need. Do we have some? Okay, all right. I think we have some technical difficulties that might not be allowing us to see your questions right now. We'll be sure to look at those after if we can't look at them now. Some people are raising their hands with questions. Are you able to look at those, Nina? I would love to answer your questions live right now. And I apologize if I can't. We're really trying. We would love to answer them live. That was our plan. We have a number of people raising their hands with questions. Thank you. I appreciate your interest, and I would love to answer everything that I can. A common question that people ask is, what is the cost of these treatments? So, and of course, costs can vary because there's such a variety of treatments that we can do. The under eye fillers, like we were showing, that we use for, oh, how can we view the video again? Is a question. So these videos will be available on our website. So if you go to the parkerclinic.com, there's a tab called Video Gallery. And if you look at our video gallery, you can see all of a number of our past news segments that have been on in recent years. You can see a number of our videos, webinars. You can re-watch them. So the parkerclinic.com under Video Gallery. You can re-watch this video if you tuned in late or if you missed it. Can you use Botox to treat under eye wrinkles or only the lasers? So Botox is wonderful for crow's feet lines at the sides of the eyes. For under eye wrinkles, we can't use a lot of Botox there. So there's a spot, if you have a little fine line there, where we can put one little drop of Botox, the tiniest bit. It actually helps to open up the eyes a little bit. So it helps to, with the upneak drops, that lifts. Botox here can lift this way. It can open up our eyes. But typically for fine lines under the eyes, we need laser. So in general, we need Botox to lift and smooth crow's feet. Resurfacing lasers really do the best job for fine lines and creepiness under the eyes. How much did Shannon's procedure cost? That's what I was beginning to explain before. So Shannon had one syringe of filler. That would have been a $700 treatment. Most of the under eye fillers that we use are $700 treatments. The cost of different fillers can range, typically from $700 to $800. But in the under eye area, we're using very light, very delicate fillers. We're not so much using the heavy duty fillers. We'll use heavy duty fillers to lift the whole face. Those can be $800 or a little more, but the $700 fillers are typically the ones we're using for under eyes. Are there side effects to Upneek? Upneek, those are the eye drops that open up our eyes. I used them myself an hour ago. They work fast. In about 10 minutes, your eyes look whiter, brighter, and more open, which is why I used them before this webinar. But the side effects to the Upneek, they're really well tolerated and they're very safe. You know, their prescription but they really are very safe. And I found that my patients who like it best, some people have one eye that looks a little more closed than the other. And so I know some people who use it in only one eye just so it looks more open like the other one. So if you're one of those people with an asymmetry, you can use it to be more symmetric. Or if you're like me and most people, you use it in both eyes so we look more awake. But they're really very safe. Most anyone can use them. Is there any downtime after getting under eye filler? A little bruising and swelling. Like we showed in the video of Debbie getting her bruises lasered after treatment, there is a little bruising and swelling. It's not terrible. I like people to plan their under eye filler for a time when, don't do it 2 days before your class reunion or your family photos. Do it at least a week before that. If you have your under eye filler done on a Monday, we can usually have your bruises chased away before the weekend because we can laser them to help them go away quicker than they might normally go away on their own. In many cases, the bruising is minor and minimal, but once in a while there's a bad bruise. So we want you to have time for us to chase that away quickly for you. Shannon never flinched. How come? It's interesting. Everyone thinks that under eye filler should be a painful procedure. So if nothing else, I hope you saw, and Shannon never had under eye filler before. She never did. It was her first time getting it done. Most people are very surprised that it doesn't hurt as much as they thought it would. So that very thin, delicate skin under the eyes numbs really well with a numbing cream. So we put numbing cream on. That thin skin numbs very well with that. And there's lidocaine in the filler. So we become more and more numb as we work. So most people really don't flinch when I give them their under eye filler. They find it to be very tolerable. For some people, it's a little nerve-wracking. They might be a little nervous the first time they get it done because they don't know what to expect. But usually if they do it again for further improvement, because it's a low maintenance thing. It's not like you have to repeat it every 4 months like Botox or Dysport. It's pretty low maintenance, but we often do it again to make it even better. All right. Can under eye filler be used on someone with heavy eye bags? Absolutely. So most people who have heavy eye bags have deep hollows and deep creases that are creating the appearance of a bag. And when we lift those hollows, they don't look like they have bags under their eyes again. So if you want to, those photos you can view again on our video gallery. But a lot of people come in not complaining about their hollows. They come in complaining about the bags. But when we lift the hollows, you don't see the bags. So as we age, we don't get puffier in certain places. We're caving in around those areas. When we lift around those baggy areas, the bags don't look bad anymore. So it's a huge help. How long should you wait after a Moderna vaccine before you get your filler? That's a good question. So vaccines have no effect on Botox injections, so you don't have to worry about that. But we recommend waiting until you're fully recovered from a vaccine. Some people after a vaccine have an inflammatory response going on. You want to wait until you feel fully recovered from your vaccine. The recommendation is 2 weeks. So wait 2 weeks after any vaccine. It's not just a Moderna vaccine or a COVID vaccine, even a flu vaccine. We recommend just let that inflammatory response that you get after your vaccine, let that go away, recover from it. Wait 2 weeks just to be super safe. If you want to be super safe, then you can get your filler. And it's also recommended wait about 2 weeks after your filler to get a vaccine if you need a vaccine after your filler. Rarely, some people get swollen hands and feet after a vaccine or, a swollen arm, and rarely someone can get some swelling in a place where their filler can get temporarily swollen. So it's really seen very uncommonly, but if you don't want to have to worry about that, keep your vaccines at least 2 weeks away from your filler injections. How long does under eye filler usually last? That's a great question. No one knows because it lasts so long. So when a product can advertise, most of these fillers that we use can advertise a 12 to 15 month duration, the ones that we use in the under eye area. And some fillers are FDA approved for claiming longer duration than that. So most people assume that that means it's gone after that amount of time, but that's actually not what it means. So a little misleading. So those companies have proven that the vast majority of people, typically about 80% of people, vast majority of people still show lots of improvement that far out. So in other words, someone who gets a syringe of filler under their eyes will 12 to 15 months later still show lots of improvement. So remember, you're a year older at that point, and your filler has probably gone down a little bit. The levels of hyaluronic acid in our skin are kind of steadily decreasing over the decades, and we're boosting our levels back up when we get a syringe of filler. But aging still occurs, so our levels will drop over time. Our natural hyaluronic acid levels that we're born with will drop over time, and when we add a little more filler, that will slowly decline over time, but the levels go down very, very slowly. We don't know that it's ever completely gone, actually. When we get filler, oftentimes it'll really, it would take a very long time to go back to looking how it was before your filler. But if you want to keep up with the aging process, or what we often do is getting a little filler once in a while will help you to just keep looking a little younger, a little younger, little younger over time instead of looking a little older and a little older over time. So these fillers are very long lasting. Can you get under eye filler and laser resurfacing at the same time? So we recommend that those two procedures be done on different days. We generally recommend that those two procedures be done at least a couple weeks apart. There are times that we will do them in the same day, but it's preferable to space those treatments at least a couple weeks apart. Any risks from under eye filler? The most common things we see are bruising and swelling, but fillers, the rare and serious risk of fillers is if some filler gets into a blood vessel, it could block or decrease blood flow to an area and cause lack of blood flow to an area. And the really rare and really serious complication of filler injection is filler going to the back of the eye and causing blindness. Now, I've never seen this happen, but it has absolutely been reported. We do lots and lots of filler injections. Surprisingly, it's actually not the under eye injections that are associated with that. The most risky areas to get a filler injection are actually in the 11 lines. Keep Botox there. Filler there is a bit more risky. We can do it. It just has to be done properly and carefully. But generally 11 lines, we're generally sticking with Botox and trying to avoid filler there when possible because it is a higher risk area for getting into a blood vessel. Injections in the nose, sometimes for a non-surgical rhinoplasty or non-surgical nose job. That's actually a riskier area for filler going back to the eye. So these are the riskiest areas, actually more risky than the under eye area. So typically under eye injections, what the side effects that we see are the bruising and swelling that we expect. How much is laser around the eyes and also for the whole face? So not to complicate things, but so we have a very wide range of resurfacing lasers. So the strongest lasers that we do, the strongest laser resurfacing for the most dramatic effect, will generally have a week or close to a week of downtime, redness, swelling, little brown dots on your skin. You might want to stay home for about a week. The lightest type of laser resurfacing, we have lesser degree of improvement, but less downtime too and less cost. So full face resurfacing lasers can range from $450 per treatment for the very lightest, clear and brilliant treatment, it's called, to the very heaviest and strongest. Those lasers can get into the $3,000 range for a full face. But for a treatment around the eyes, just for limiting to that area, those treatments, depending on how much of your eye area we're treating, might range from $400 to $1,000 for a treatment. I highly recommend treating not only the under eye area, but if you're over 40, I would say consider getting the upper lid treated. Also, tightening that upper lid skin is really helpful. It's honestly the best way to tighten up that skin without surgery. what laser did Dr. Meek use on me? So that was our newest resurfacing laser. It's called the hybrid laser. And it's called the hybrid laser because it's really like multiple lasers in one, but we can, with that one single device, we can do the very gentlest of resurfacing for little to no downtime to the very strongest type of resurfacing for an aggressive, more dramatic result with some more downtime up to a week. Or we can kind of go somewhere in between or do a blend of gentle, little strong. So it's the newest and most flexible laser, and it's my favorite one to use right now. And that's the one that I last had done. Okay. So I know we have lots of questions here. It's possible I didn't get to all of them. Nina, is there a way that I can see more of these? Let me just look and see if I missed any questions that are not redundant. Would I repeat the names of the different under eye fillers, and what was the name of the one that Shannon got? So Shannon had Restylane under her eyes. So the names of the under eye fillers, the only one that's FDA approved for IOH, we call it, and for orbital hollows, or the hollows under our eyes, the only one that's FDA approved for that and could advertise it if they wanted to is Volbella. Volbella is in the Juvederm line of fillers. So no other fillers will advertise for use in that area, but there are other fillers that can be used and are often used in that area. Restylane or Restylane Silk. Silk is the lighter, more delicate one. And in the RHA line of fillers, that's the newer line of fillers that came out a couple of years ago. Their latest one called RHA Redensity. I have used under my own eyes and recently actually had to touch them up before this webinar, right? I've been using it quite a bit on my patients and very happy with the results. So those are the ones that we see and use most under the eyes. Oh, seeing some questions. Can Upneek be used on a minor? That's an interesting question. Oh, for ptosis, yeah. Absolutely. Upneek can be used on someone who's younger. So again, in this case, someone who's younger and born with ptosis, or ptosis is kind of looks like a sleepy eye or a lid that's down a bit. Upneek is the perfect product for that. So yeah, your daughter would do very well with it. And actually, I should tell you that if you are considering Upneek and thinking you might want a prescription for it, you do need a prescription. So you need an appointment to get the prescription. Virtual appointments are an option. But if you come in the office for an appointment, one, you can buy the Upneek here. Even though it's a prescription, it's a cosmetic prescription, insurance will not pay for it. It's a cosmetic prescription. And the Upneek is a little bit less expensive here than at pharmacies. So anyway, but we often have some samples of Upneek. So if you come in the office and we think you're a good candidate, sometimes we're able to let you put a drop in your eyes, or in this case in one eye, if you only need it in one eye. And it works in 10 minutes. So we can let you use it in the office. We'll see how you look with it. We'll see how you like it. And you can try it for free. Because Upneek, the cost of Upneek is $200 for a box of a good number of individual single-use droppers. So let's see, any other questions that I should answer before we leave? Do lasers work in more extreme droopy upper eyelids? So here's the thing, everybody's upper lids get droopy, right? It just happens to all of us. And at some point, if you let it get bad enough, or an extreme case, as you're asking here, if you let it get bad enough, eventually Medicare will pay for you to have surgery on your upper eyelids, okay? Because at some point they're so droopy that it actually restricts your visual field. It can actually limit your peripheral vision, and it will be good for your vision to get those eyelids out of the way. So when we see that someone has enough drooping that they really should have surgery, we will let them know that you should have surgery. We still want to do things for best results. Even a good surgeon will tell you should still get Botox to keep your brow up and do other things to make it even better. But if it is an extreme case or some more serious droopy upper eyelids, we may recommend surgery for you, and your insurance may pay for it. So that's the good thing about waiting a while. Okay. I'm in my 70s with under eye bags. Can it be corrected at my age? Absolutely. So we treat people of every age. So under eye bags, yes, we treat all the time. We treat women and men in their 70s and in their 80s. I have even treated people in their 90s who look fabulous, and they are my role models, and I hope I look as fabulous as they do when I'm in my 90s. So absolutely, 70s is not too old. I treat people in their 70s every single day. What is the cost of the Upneek drops? We answered that. Yes, you do need a prescription. Yes, we do participate in the Alley program. So Alley is the rewards program from Allergan. Allergan is the company that makes Latisse eye drops. They make the Juvederm fillers, including the Volbella under eye filler. They make Botox. They make Skin Medica skincare products. They have cool sculpting. So whenever you get any of those products or procedures done, you get points and you get rebates and you get rewards, and you can use them toward other procedures in that group. So yes, we're a huge Alley account. Our patients redeem lots and lots of rewards here. So our front desk is wonderful at helping people earn their points and redeem their rewards. How does filler get rid of the dark circles? So yeah, most people think it's dark because they think there's pigment there. Now, some people actually do have pigment there, and we can lighten that up with different kinds of lasers that remove brown spots and brown pigment. But most people, almost everybody, has a shadow there. So the dark is a shadow, and we can eliminate the shadow by lifting the skin that's deep in the hollow there. So most people that we see just need filler and don't have to get lasers for brown pigment under the eyes. So, and most bags just need filler around them to lift the skin that fell around them. The results are great. Can you order the eyebrow and lash growth products to ship? Absolutely. You can either call the office and let them know what you need, or you can go to our online store. If you go to www.theparkerclinic.com, you can catch a link to our online store and you can order it that way, and we will ship it to you. And if you buy the brow and lash growth product, my guess is you will have free shipping. So yeah, by all means, we can ship that to you. The new Albaji products work quite well. I'm using them. I was a faithful Latisse user for many years, loved it, did great with it. I'm loving the brow product. My brows were very sparse and now they're not. The lash product is nice and easy to use and works really well. So I've been quite happy with it. Okay, I think most of these questions are, how often should you do your under eye treatments? Does insurance cover any of these treatments? Insurance does not cover any of these treatments. They're all, everything we talked about today is cosmetic. Nothing we talked about today is covered by insurance. Sadly, unfortunately, if you have really droopy upper eyelids and we think your insurance might cover for surgery, we will send you to a great surgeon to have it done, evaluated by the surgeon and treated surgically through your insurance. If you can get something done through your insurance, that's about the only thing for the eyes. And how often should you treat your under eyes with under eye filler? In the beginning, we might treat it a little more often. Sometimes if someone has pretty bad bags under their eyes, pretty deep hollows under their eyes, if they really need their cheeks lifted a lot, so the more dropped your cheeks are, the more heavy duty lifting we might have to do up here. You might need more syringes. The older you are, the more syringes you might need. The younger you are, the fewer syringes you might need. So sometimes in the beginning, if you're going to need a few syringes to look your very best, if you would like to look your very best, then we might plan on a few sessions to get you there. It's not that you're repeating it for maintenance. You know, Botox is an every 4-month thing for most people, or 3 to 6 months for others. So this isn't something that you have to do with that much frequency, but basically once you've got it looking good, it can be pretty low maintenance. So, you know, as time goes on and you start to look a little tired under your eyes again down the road, it might just, you know, in the beginning, it could be a couple or a few syringes to get it looking, go from, you know, looking really tired to looking really fabulous. And then, you know, something like 1 syringe once a year could probably more than maintain that for you. Might even let us get a little filler somewhere else that'll help you, you know, because some people need filler way up here in the temple area to kind of hold up our whole face, but it helps the eye area and helps keep the brows up too. So, you know, the more often we see you, the more we can help you, but we'll always try to work within your budget and do what works best for you. So thank you everyone for your attention. I appreciate all your attention, all your questions. We will be choosing a winner. Thank you all for hanging in there. Those of you who have watched the webinar you are all automatically entered into our drawing for a free year of Botox, a fabulous gift from Allergan. Thank you so much, Allergan. So we'll be running a random number generator and seeing who the lucky winner is. And one of you will get a call tomorrow saying that you won a free year of Botox. So thank you so much. Hope to see you in the office. Have a good evening.